Nyla Flato with the Hidalgo County Wellness Program. This is our YouTube series where we share information to our employees and community to help keep you healthy and informed. In honor of American Heart Month this February, we are highlighting the importance of heart health. I had the opportunity to sit with Dr. Madrid from Frontier Direct Care, and she shared some valuable information that we can all benefit from. Hope you enjoy this. Thank you for joining us, Dr. Madrid.
Thank you for inviting me. I'm happy to be here.
We're happy to have you.
So February is Heart Awareness Month. Heart disease is the #1 killer of men and women. So it's an important topic to discuss today.
Extremely important. That's why we're glad to have you and would like for you to talk more about heart health and inform us so that we can share with our employees and community.
Definitely.
To start us off, what are the early signs the heart might need attention? Signs that sometimes even people or young people may ignore.
So every visit with a patient, I always ask the same questions. Are you having headaches? Do you have dizziness? Is there any chest pain? Are you having trouble breathing? And are you noticing any swelling in your lower extremities and your legs?
Okay, so those are really important signs to pay attention to.
They are. That's what I start with, especially because the majority of my patients already have comorbidities like diabetes and high blood pressure. But if someone is in their first visit, I still ask those so it can guide me to make sure that we're taking care of everything.
Great. And you know how I mentioned that there's signs that are overlooked and sometimes young people feel like, oh, I don't have a heart issue. But heart health does affect young people as well.
It does.
And it's the same signs?
So more important for young people, I would say chest discomfort, chest pain, and trouble breathing. And so along with, I know we're talking about heart health, but along with like asthma. So your child is in PE and they're running, and last week they were fine. This week they're having trouble breathing. They can't run that lap that they used to run.
Yes.
So that, and it's continuing. It wasn't just a one period, just the one day. So for younger adults, I would say trouble breathing with some chest discomfort.
That's good to know. How much does family history matter compared to lifestyle?
So again, when I'm talking with a patient, I take family history into account, especially with heart health. If a father had a heart attack, open heart surgery, or a stroke in their 40s, or mom had the same heart attack, stroke, open heart surgery in her early 50s, then that guides me to, okay, what are your other risk factors? Are you smoking? Are you overweight? Do you do any exercise? What is your diet like? So family history guides me, but it's lifestyle that's going to make the changes for you.
Okay, so it's safe to say if you do have the family history, or you know you have a parent or your mother that do have heart issues, then be proactive and get checked.
Definitely. And start earlier than when they had their illness. So it's very important for patients to get their family history if they're able to.
Okay. Now, in everyday life, we have stress. Stress is something we deal with daily, and burnout. And how does that affect or contribute to the heart?
So my patients, a lot of the patients have stressors that can either be short-term. Let's say you're in a car accident. You're in a car accident, you get nervous, your blood pressure goes up, you go to the ER, and that's when I see patients back. They gave me this blood pressure medicine. I have your history. There is no history of high blood pressure ever out of an office visit. So no, you don't need the blood pressure medicine. But in other cases, stressors, you're taking care of an elderly parent with dementia. You have a sick child at home or a special needs child that needs 24-hour care. You're at work and that person is at home, and so this stress is constant. It's constant stress.
Yes.
You release chemicals in your body that can lead to inflammation, high blood pressure. So we don't treat the high blood pressure in the beginning, but if you're under constant stress and it's causing the high blood pressure, then eventually I need to, and the stressor is not going away, I'm going to need to start treating the blood pressure because that stress is constant. So stress definitely contributes to heart disease.
Okay, and another question would be, when you're stressed and you become anxious or anxiety, how can you differentiate, or when should you worry when you're feeling, that shortness of breath, and it may be due to an anxiety attack or that issue? So how do you differentiate between that, or how to treat that?
So yes, you'll have very similar symptoms, but we want to look at the context of what was happening. Did you get bad news on the phone? Were you at work and, you were reprimanded? So was there a stressor immediately preceding the symptoms? And did your symptoms last less than 30 minutes, or it's getting better with time? Then that's a normal stress response. If abnormal would be continuing to get worse, that chest pressure that's getting tighter and tighter, lasts more than 30 minutes, leading to other symptoms like shortness of breath, sweating, then we're not dealing with, and there's no stressor, obviously, with that. You could be sitting down watching TV, or most common after a meal. So we want to look at, okay, what happened immediately prior? What were you doing when you started feeling the symptoms? If there's no stressor, then we do want to look at more issues with heart disease, go into your family history, get full details.
Okay, thank you. I know earlier you mentioned lifestyle, you mentioned smoking. What is your take with smoking, coffee, alcohol, and how that affects your heart and heart disease?
Definitely. So lifestyle modifications will prevent a lot of illness. Here in the Valley, we have diabetes, high blood pressure, cholesterol. I call it the triad. And number one, I start with lifestyle modifications. So one of those is what you're drinking. Coffee gets a bad rap, and then it gets a good rap. Coffee in moderation. So a cup of coffee in the morning, but not these sweet sugary drinks that are this big. We want to make sure it's a cup of coffee, and you have your regular amount of creamer with your sugar or honey or whatever sweetener you like.
Yes.
And it's just a cup, not these large drinks that are full of sugar and extra calories. But a cup of coffee coffee in moderation is not a problem. You can find different articles that tell you coffee is good for you, coffee is bad for you.
Yes.
But coffee in moderation is fine. Smoking, on the other hand, can definitely cause it causes more inflammation. So if you already have high blood pressure, on top of the smoking, it's just a higher risk for heart disease and heart attacks and strokes. Alcohol, again, a drink here and there, but you need to be honest with yourself and ask yourself, how much am I drinking every day? Is it every day? And be careful with the amount, because alcohol and coffee, and then alcohol and smoking can cause more issues.
More issues will affect your heart.
Yeah, it will affect your heart. You don't want to drink your alcohol and smoke at the same time either, because then that inflammation is just more rapid.
Life is busy. Everybody's busy working and having to do all these extra activities. Not a lot of people get the 8 hours of sleep or the recovery they should. Yeah. What's your take with sleep and recovery, and how does that also affect heart health?
I see a lot of patients also that work nights, and they come into their early morning appointment and their blood pressure is out of control. When we sleep is when our body rests and recovers. and we need 6, now it's 6 to 8 hours. Some studies say 7 to 9 hours of sleep. But again, so without sleep, it raises blood pressure, causes more inflammation in the body because we're not resting our muscles, our heart. Our heart, when we do sleep and reach deep sleep, gets down, the pulse goes down. Bringing your pulse down brings down blood pressure. So it's a time for recovery. It wasn't that long ago that patients were ending up at the ER with stroke-like symptoms. Nobody could figure out what's going on because they don't have high blood pressure. That's when they discovered sleep apnea. And so people who aren't sleeping well, including for sleep apnea, can have a higher risk for strokes.
Yes, and now that you mentioned sleep apnea, I know that does affect your heart. Can you touch on some of the symptoms of sleep apnea, just to kind of educate and let our employees and community know if you're having these symptoms, you may need to go get tested for sleep apnea?
Yes. So it's usually the partner that complains. Snoring, so your throat is closing from all the pressure, tongue falls back, throat closes, and the brain is smart. The body is smart, and it forces, with snoring, it forces everything to open up so that you can get that breath in. But some people stop breathing for up to 2 minutes, maybe even longer. And in that time, you're not getting oxygen up to your brain. So that's what's causing those stroke symptoms. So snoring, not breathing. So maybe you don't have the loud snore, but your partner's like watching you and you're not breathing, you're not taking a breath. and so it's usually the partner that notices the symptoms because we're asleep, we don't notice. Now, when you would notice would be in the morning. You still feel tired, like you didn't get any sleep. You're having trouble with headaches and the dizziness. So that goes back to the first question so what are we looking for and what do we ask? So if there's headache and dizziness, tired right after you wake up, when you thought, I got 8 hours of sleep, then we may be looking at something like sleep apnea.
Yes, you actually didn't get the 8 hours of sleep.
You do not.
Okay. What's one change people tend to underestimate that can be a big long-term difference with heart health?
The one thing I would do, and it goes back to lifestyle modifications, is increase your activity. So instead of fighting for that front parking spot at H-E-B or Walmart, go park at the end and take those extra steps. You don't have to go train for a marathon to have significant effects from exercise. You just have to add more steps to your day. And start off with, if you've never done anything, I would start off 5-10 minutes of regular walking. Like you're not out there speed walking. We just want to get your joints and your muscles moving to get used to the feeling, and that way you're not getting sore and not going back the next day. But activity, increasing your activity and adding those extra steps in your day.
That's one thing we try to do here at the county. Yes,
I just saw someone walking around the parking lot.
Yes, we have Step It Up challenges, and we have at least 6 to 7 throughout the year. But we like to have our employees getting their steps in and keeping healthy. Yes. So that's good to hear.
No, I did see someone, and I remember during open enrollment, y'all had the lanyards.
Yes.
And I asked, what is the 5K, 10K? I don't know if anyone did more than that, but yeah, so I heard that was steps.
Yes, we have steps. We have 6K, 8K, 10K, and we just started a 15K. So we brought in a new tier to kind of get everybody to want to step it up and do more steps.
So that means you had people walking and they needed to move up to the 15. That's amazing.
Yes. Well, Dr. Madrid, to wrap up this interview, I know my question to you is, what is something small we can do to help our heart health? I keep hearing you mention lifestyle.
Yes.
So is it basically your way of living lifestyle, things you do, or what else would you recommend?
So really, that's where it starts with, and diet, exercise, weight loss. The weight loss doesn't have to be significant. We're looking at 10% in over 6 months would make a big difference. Easy math, a 300-pound person, 10% would be 30 pounds over 6 months. We're looking at 5 pounds a month, and that's like a pound a week. So it's not the significant amount of weight loss that needs to be done. That's not going to be, you're not going to be able to continue.
Mm-hmm.
So I would say just, it all comes back to lifestyle modifications, diet, exercise, weight loss, so that you can live a longer, healthier life despite some family history.
Well, thank you.
Thank you.
Thank you, Dr. Madrid, for joining us today and sharing your expertise. All county employees under the county's medical plan have access to Frontier Direct Care. For more information, contact the number on your screen and make your appointment today. I'd also like to remind you to please subscribe to our YouTube channel so that you can keep informed with the information and education we're putting out there for our employees and community to keep you healthy. Thank you for joining us.